Which cellular process allowed her to nurse the infant? Answer: A. Lobular hyperplasia. Explanation: size of the breast increases during pregnancy due to hypertrophy and hyperplasia of ducts and alveoli under the influence of estrogen and progesterone, enabling successful lactation. Stromal hypertrophy also occurs, but it is not related to milk production. The process involved in the development of a mature ovum is called. Answer: B. Oogenesis. Explanation: oogenesis is the developmental process by which a mature ovum is formed from an oogonium. It includes growth and meiotic divisions that result in a single functional ovum. 111. During process of gametogenesis, the female and male sex cells divide and then contain. Answer: haploid number of chromosomes in their nuclei. Explanation: sperm and ova are sex cells, germ cells, and contain a haploid N set of chromosomes after meiotic division. Freshly released human egg has. Answer: D. 1 X chromosome. Explanation: the ovum always carries 22 autosomes X chromosome. Sperm may carry either X or Y. 113. The diameter of a fully mature ovum is about. Answer: 130 microns. Explanation: the mature ovum is the largest cell in the human body, measuring about 130 microns, 0.13 millimeters. 114. An individual has maximum number of oocytes. Answer: D. At 20 weeks of gestation. Explanation: a female fetus has about 7 million oocytes at 20 weeks of gestation. This number decreases thereafter. 115. Of the 6 to 7 million oocytes available, how many are released during ovulation? Answer: C. 400 to 500. Explanation: only 400 to 500 oocytes are ovulated during the entire reproductive lifespan of a woman. 116. In oogenesis, resumption of meiotic division and release of first polar body occur during. Answer: B. Ovulation. Explanation: the primary oocyte completes meiosis I at ovulation, forming a secondary oocyte and the first polar body. 117. The first evidence of pubertal development in females is usually. Answer: B. Appearance of breast buds. Explanation: appearance of breast buds, the larky, is the earliest sign of puberty in girls. 118. The first event of puberty in girls is. Answer: B. The larky. Explanation: the lark or breast development precedes all other pubertal changes. 119. The correct sequence of development of puberty in girls is. Answer: the lark, pubarch, menarche. Explanation: normal sequence. 1. The lark, breast development. 2. Pubarch, pubic hair. Menarche, onset of menstruation. Hack 120. Physical changes in adolescent girls include all of the following except. Answer: C. Beard growth. Explanation: beard growth is a male secondary sex characteristic not seen in normal female puberty. 21. Onset of puberty before the age of 8 years in girls is called. D. Precocious puberty. Explanation: appearance of secondary sex characteristics before 8 years in girls is defined as precocious puberty. 22. Which of the following is not a common site for dermoid cyst? Answer: B. Ovary. Explanation: dermoid cysts, mature teratomas, commonly occur in the ovary, so it is not the not common site. Therefore, this option is incorrect in the question's context. Hadra 123. A 32-year-old woman presents with infrequent periods, which is not consistent with PCOS. Answer: D. Decreased LH. Explanation: PCOS is characterized by increased LH, increased androgens, and an increased LH-FSH ratio. Decreased LH is not seen. 124. Which hormone is increased in polycystic ovarian syndrome? Answer: B. Luteinizing hormone, LH. Explanation: PCOS patients typically have high LH levels, causing excessive androgen production and anovulation. 125. Physical changes in adolescent girls include all of the following except. Answer: C. Beard growth. Explanation: beard growth is a male secondary sexual characteristic. Girls develop breast buds, pubic hair, and menstruation instead. 126. Onset of puberty before 8 years in girls is called. Answer: D. Precocious puberty. Explanation: secondary sex characteristics before 8 years, girls, or 9 years, boys, is termed precocious puberty. 127. Intermenstrual bleeding. Differential diagnosis does not include. Answer: B. Ovarian teratoma. Explanation: intermenstrual bleeding commonly occurs due to cervical or endometrial causes. Ovarian teratoma is not a cause of such bleeding. Hortha 128. Hormone increased in polycystic ovarian syndrome. Answer: B. Luteinizing hormone, LH. Explanation: PCOS leads to elevated LH, contributing to anovulation and androgen excess. 129. Full form of DUB. Answer: C. Dysfunctional uterine bleeding. Explanation: DUB refers to abnormal bleeding without pregnancy, tumor, or infection, often due to hormonal imbalance. 130. Treatment of DUB in young women is: Answer: hormones. Explanation: DUB is caused by hormonal imbalance, hence hormonal therapy, e.g. OCPs, is the main management. 131. A 69-year-old female with dyspareunia, initial management. Answer B. Topical hormonal cream. Explanation: postmenopausal vaginal dryness due to estrogen deficiency responds best to topical estrogen creams. 132. Which is not a symptom of vaginal atrophy. Answer: A. Lengthening of vaginal canal. Explanation: vaginal atrophy causes dryness, narrowing, shortening, and thinning, not lengthening. 133. A vaginal fistula opening into rectum is called: Answer C. Rectovaginal fistula. Explanation: an abnormal communication between the rectum and vagina is termed a rectovaginal fistula. 134. Methylene blue injected into bladder appears in vagina. Diagnosis: Answer D. Vesicovaginal fistula. Explanation: leakage of dye from bladder into vagina indicates a vesicovaginal fistula. Capture 135. Common causes of vesicovaginal fistula. Answer D. All of the above. Explanation: instrumental delivery trauma, ischemia, pressure necrosis, and cesarean section all can cause VVF. 136. After fistula repair, nurse should advise. Answer: both A and B. Explanation: post-repair care includes abstinence for 3 months, next delivery by cesarean section. At 137, 30-year-old woman leaks urine while coughing. Suspect. Answer: cystocele. Explanation: cystocele causes stress incontinence leading to leakage with coughing or laughing. 138. The most common genital prolapse is: Answer A. Cystocele. Explanation: cystocele, bladder prolapse, is the commonest type of pelvic organ prolapse. 139. Painful menstruation is known as: Answer B. Dysmenorrhea. Explanation: dysmenorrhea equals pain during menstruation. Amenorrhea equals absence of menstruation. 140. Regular episodes of bleeding that are excessive in amount are called: Answer B. Menorrhagia. Explanation: menorrhagia equals excessive or prolonged menstrual bleeding. Metrorrhagia equals bleeding between periods. 161. The most common cause of oligohydramnios is: Answer C. Premature rupture of membranes, PROM. Explanation: PROM leads to continuous leakage of amniotic fluid, making it the leading cause of oligohydramnios in pregnancy. 162. The normal fetal lie in late pregnancy is: Answer A. Longitudinal lie. Explanation: in 95% of pregnancies, the fetus aligns vertically with the maternal spine, called longitudinal lie. 163. The earliest sign of preeclampsia is: Answer B. Hypertension. Explanation: a BP of 114/90 mmHg after 20 weeks is typically the first clinical clue of developing preeclampsia. 164. The presenting part in breech presentation is: Answer buttocks. Explanation: in breech, the fetal buttocks or lower limbs occupy the pelvic inlet instead of the head. 165. The most sensitive marker for neural tube defects is: Answer A. Maternal serum AFP. Explanation: open NTDs allow fetal AFP to leak into amniotic fluid and maternal blood, causing elevated MSAFP. 166. The drug of choice for treating severe preeclampsia is: Answer B. Magnesium sulfate. Explanation: magnesium sulfate is the first-line anticonvulsant used to prevent and treat eclamptic seizures. 167. The duration of normal postpartum lochia discharge is: Answer C. 4 to 6 weeks. Lochia progresses from rubra serosa alba, lasting up to 6 weeks after delivery. 168. The safest method of contraception during breastfeeding is: Answer A. Progestin-only pill. Explanation: progestin-only methods do not affect milk production and are safe for lactating mothers. 169. The purpose of a non-stress test T is to assess: Answer D. Fetal well-being via heart rate response. Explanation: NST checks FHR accelerations associated with fetal movements, indicating good oxygenation and neurological status. 170. The most common cause of postpartum fever is: Answer C. Endometritis. Explanation: endometritis is an infection of the uterine lining, commonly occurring after cesarean delivery or prolonged labor. 171. The placenta develops from which embryonic structure? Answer B. Chorion frondosum. Explanation: the chorion frondosum forms the fetal part of the placenta, contributing to nutrient and gas exchange. 172. The primary function of relaxin in pregnancy is: Answer A, soften pelvic ligaments. Explanation: relaxing increases the flexibility of pelvic joints and ligaments, aiding childbirth. Hashtag 173. The most reliable method to confirm rupture of membranes is? Answer: amniotic fluid crystallization test, FERN test. Explanation: the FERN pattern under microscopy confirms the presence of amniotic fluid with high accuracy. 174. The normal fetal position for vaginal delivery is? Answer: left occipito-anterior, LOA. Explanation: LOA is the most common and ideal position, allowing smooth flexion and descent of the fetal head. 175. The main complication of untreated gestational diabetes is? Answer: macrosomia. Explanation: excess maternal glucose leads to fetal hyperinsulinemia, causing excessive fetal growth, 4 kilograms. 176. The primary cause of early neonatal jaundice is? Answer: physiological immaturity of the liver. Explanation: neonates have reduced bilirubin conjugation, leading to normal physiological jaundice after birth. 177. The uterus becomes palpable abdominally at? Answer: 12 weeks. Explanation: at 12 weeks, the uterus rises above the symphysis pubis and becomes palpable on abdominal examination. 178. The definitive diagnosis of placenta previa is made by? Answer: B, ultrasound. Explanation: ultrasonography, particularly transvaginal, is the most accurate method to confirm placenta previa. 179. A Bishop score assesses? Answer: C, cervical favorability for induction. Explanation: the Bishop score evaluates dilation, effacement, station, consistency, and position to predict successful labor induction. 180. The major risk factor for shoulder dystocia is? Answer: A, fetal macrosomia. Explanation: large babies 4 kilograms have increased shoulder width, making them prone to shoulder impaction during delivery. 181. The most common cause of neonatal respiratory distress syndrome, RDS, is? Answer: D, surfactant deficiency. Explanation: premature infants often lack adequate surfactant, leading to alveolar collapse and respiratory distress. If you want, I can